This is One on One. Welcome back. I'm Steve Adubato. As you can see, we're remote, and we are honored to be joined by Dr. Denise Rodgers, Vice Chancellor for Interprofessional Programs at Rutgers, the State University. Denise, good to speak to you, Dr. Rodgers.
Same here. Thanks, Steve.
We are again taping on the 8th of April, looking long-term at the implications of this horrific pandemic. Dr. Rodgers, your understanding as to why a disproportionate number of African Americans are being affected, impacted, and many dying because of this virus, disproportionate to the population anywhere you look.
So I have to confess that this finding, while enormously disturbing, is not surprising if we look at the legacy of health disparities in African Americans in this country historically. The very reasons that we see disparities in African Americans in terms of the burden of chronic illness that exists in the African American community, things like diabetes, hypertension, heart disease, they all contribute then to those who get COVID-19 being more likely to have significant adverse outcomes, including death. And that's why one reason we see these disproportionate deaths. The other reason is if we look at underserved populations and the kinds of jobs that they have, they're more likely to be in jobs where they're going to be exposed. So people who are transit workers, people who work in grocery stores, that sort of thing. These essential services that we need to keep going obviously are putting, in some instances, underserved people at higher risk.
Dr. Rodgers, let me ask you this. Again, we're taping on the 8th of April. We'll be showing this later. Hopefully, we'll be talking about coming out on the other end of this, but the implications of this are long-term, significant, and we cannot afford, obviously, to make the same mistakes. What is the biggest lesson so far that you feel we need to take moving forward that will help us potentially in the future if we face another pandemic?
I think there are several very important lessons that we are learning during this pandemic. The first of which is somewhat related, but not entirely related to disparity in outcomes by race, ethnicity. And that has to do with we can never allow our public health infrastructure to be as weakened as it was when we are now confronting this pandemic, I should say. The second thing is we have known about health disparities for over 30 years. It's been well documented. We've made incremental progress in improving those disparities, but clearly a time like this says that at the other end of this, we must do more because all we do then is leave the most vulnerable even more vulnerable. We need universal access to healthcare because a major obstacle to people being able to treat their chronic illnesses, which then would prepare them better to face something like this, is disparate levels of ability to just get basic good primary care. Very important lessons for us that must come out of this.
Dr. Rodgers, let me ask you. We've been a part of a whole range of meetings off the air in cooperation with the folks at RWJBarnabas Health, Newark Beth Israel, one of their hospitals. And we have this Newark Community Advisory Board. And the reason I mention it is because so many of the people around that table, in addition to clinicians, are civic leaders, are nonprofit leaders, are elected officials. What is the biggest lesson you take away in terms of the need to come together? I don't mean that in a kumbaya moment that where someone, they minimize that or they think it's, not really real. How much do we need each other to really deal with this as opposed to that's the hospital system, that's the healthcare system? Isn't it all of us?
It's absolutely all of us. And what complicates this even further is in a pandemic like this, not only is it all of us locally that have to come together, we have to come together as a country and we have to come together as a world. There's nothing like an infectious disease pandemic to remind us that we are all interconnected in this world in ways that will last in perpetuity. We can never go back. And so, yes, we need our local politicians and our healthcare executives and people who are just day-to-day citizens saying, we're in this together. We need to collaborate with each other. We need to take responsibility for each other. This is not the time to say, pull yourself up by your bootstraps. This is a country where you kind of make it individually on your own. This is one of those situations that remind us that if all of us don't do our part, it endangers the survival of all of us.
Last question. Are you afraid on some level? I mean, we talk a lot about social determinants of health. And again, that's connected to a lot of the things you've been talking about, whether it's poverty or race or the lack of transportation, a whole range of issues. The unemployment factor here, the numbers are growing as we speak, as we're doing this program in April. What potentially could that mean moving forward in terms of the quality of people's health? Because healthcare is tied so directly to working.
Steve, there is no question that if we don't begin to think about how we take deliberate action at the end of this pandemic, those who are most vulnerable will become even more vulnerable. So not only do we have a situation where those who are most vulnerable are going to be those who are hired last as the economy recovers, but if we think about it, if they're disproportionate deaths, they also have less family members to contribute income to be able to keep these families with food and housing and the basic necessities. And so we could, as a country, take out of this equation the concern about access to healthcare by providing universal access to healthcare for everyone in this country. And I'm not about to say I think one plan is better than another. What I'm going to say is there's no question that everyone in this country needs to have access to affordable, high-quality healthcare if we're going to be able to thrive as a nation moving forward.
So finally, you connect the lack of, or the fact that not every American does have the kind of healthcare coverage that you just described, that we all believe should be the case. That is connected to this pandemic.
Absolutely. It's connected less to the spread of the illness.
Right.
It is more connected to who does better and who does worse. What I will also say, though, is in addition to making sure everyone has access to healthcare, we can never again be short-sighted about the need to adequately fund public health, because I do directly connect that to the spread of this pandemic throughout our country.
Dr. Denise Rodgers from Rutgers, tied to our longtime friends and folks at RWJ-Barnabas Health as well. Rutgers and RWJ-Barnabas Health are partners in this. I cannot thank you, not just for being with us, but for everything you do as a clinician as well, and all the healthcare workers who are out there. It sounds like a cliche, but continue to be safe, be strong. And I know we'll talk to you down the road, hopefully face-to-face one day soon. Thank you, doctor.
Thank you.
I'm Steve Adubato. Thank you for joining us. Stay safe, stay well, stay home. If you're watching this when that is in fact what you should be doing, we'll see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by RWJ-Barnabas Health, the Healthcare Foundation of New Jersey, the Russell Berry Foundation, the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, New Jersey Board of Public Utilities, Clean Energy Program, NJM Insurance Group, Investors Bank, and by the New Jersey Economic Development Authority. Promotional support provided by the New Jersey Business and Industry Association and by New Jersey Globe. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.